Yesterday's cabinet meeting was extraordinarily interesting. And I think it's not only captured in the notes, but we will very likely hear from Minister Melvin Nicholas, who will convey that spirit. Minister Melvin Nicholas.
Yes, thank you. Good morning, Ambassador. And first of all, let me thank you for filling in the breach for me last week when I wasn't able to attend. And also let me take the opportunity to wish each and every one of the persons viewing and listening to these proceedings all the best for the Yuletide season. Yesterday's cabinet meeting certainly had as its focal point the whole discussion on COVID, and more importantly, a matter that will be brought before the Parliament this morning, and that has to do with the lifting of the state of emergency. Let me first report that the government still intends to lift the state of emergency, and I'll give details in a minute. But we had to be mindful of the emerging threat of the Omicron variant. For whatever perceptions persons may have, the fact of the matter is that it has captured global attention with its rapid spread, and it is likely to reach our borders before not too long. And the impact of it, of course, it could have and may very well have a further disruptive impact on our tourism industry. And so accordingly, the government has had to weave that consideration into its own position going forward with the lifting of the state of emergency and, of course, implementation of some other measures that we deem necessary to manage our way over this festive Yuletide season, certainly into the first week of the new year. The notes would give some outlines of the consideration that the Cabinet would have given, but let me take the opportunity, and again in consideration of the fact that we are having an abbreviated session this morning, to speak very quickly as to those changes. This morning, the Prime Minister will ask the Parliament to consider lifting the state of emergency, and we are asking, as of midnight on the 23rd, that the state of emergency will be lifted. We do consider this as a conditional removal. We clearly wanted to send a clear signal that we wanted to reopen the economy, certainly beyond the Christmas holiday season and into the new year. But we are cautious, and we remain cautious because of the pending threat of the Omicron virus, which, of course, the Omicron variant, of course, no one, including the WHO, has all of the necessary studied information yet. So on the 24th, 1 second after midnight on the 23rd, the state of emergency will be lifted. Of course, I'm sure there will be some measure of debate in the lower house in a few moments. In further consequence of that, we know that there is going to be teaming activity in and around St. John's for the holiday seasons. We still have, from the report given by the Minister of Health and, of course, the Chief Medical Officer and the other medical officials who were with Cabinet yesterday, did give a fairly reasonable position of the epidemiological position. We have 27 active persons. No one is hospitalized. And to the extent that those numbers are manageable, it provides some comfort. But that is not to say that it cannot change at a moment's notice. The Chief Medical Officer indicated that they have been sending samples of the more recent cases, including the 27 that we have, to CARPHA for evaluation, such that they could do the necessary screening to determine if any of those persons are being infected by the strain of Omicron. So we have not yet had any indication yet back from CARPHA, but it is a continuous process. And the Chief Medical Officer says that it's going to be an ongoing process until we are sure where we stand with that. Over the holidays, and you would have been aware that last week we would have engaged with members of the promoters community for FETs, and they had asked us to look at raising the limit beyond 300. In accordance with the enhanced threat from the Omicron variant, the Cabinet made a determination, perhaps maybe to the regret of the promoters, that we have to maintain the numbers at 300. They have indicated that the 300 is not an economically feasible position for them, but clearly there has to be a balance in this arrangement. Should a promoter deem it feasible that they can still work with those numbers, they will be permitted to operate. There will only be one approval on any given day, and of course all of the other protocols that we would have discussed would apply. Some of the other changes that we would have discussed yesterday and the regulations will be amended appropriately in the coming days, and that will include the question of bars. We are aware that there are some bars that are specifically large enough to accommodate hundreds of persons, and we're not satisfied that sufficient provisions are put in place to ensure that the regulations as prescribed, persons who are attending these functions should only be fully vaccinated persons, and the only vaccination card that is permitted from Antigua would be the recently issued ID vaccination cards. We had made the further provisions that persons who have traveled from abroad and have already produced vaccination certificates from the distant origins, those vaccination certificates will be permitted as well. But notwithstanding, we are not satisfied that sufficient screening is being done at the entry points for these bars. We are concerned again that the Ministry of Health officials are concerned about large gatherings, and so accordingly, over the holiday period, and we're speaking as of this weekend, starting on Friday, all the way into January 7th, we are going to be limited, the attendance of bars and clubs and restaurants at a maximum of 150. The maximum of 150. Clearly, if the facility is too small to accommodate 150, clearly the public health officials from CBH will also regulate the numbers that can attend smaller facilities. But there are facilities that can accommodate upwards of 200 and 300. We are going to be dialing back those numbers and ensuring that that number is kept up to 150. We had, and the notes would reflect, a significantly long and detailed discussion with the Commissioner of Police and his deputy, and the Central Board of Health head, and the Ministry of Health in terms of enforcement of these regulations. We are going to strengthen the regulations to require bars, restaurants, and clubs to submit their prescriptive treatment of the regulations to the Central Board of Health, which is to say they will have to give a warrant that they have put these mechanisms in place in the coming days between now and the 24th to ensure that they are doing whatever is necessary to keep us all safe. We made a further step that of the available 10,000 doses of doses of tests, antigen tests that are available. We are going to make those available to bars, clubs, restaurants, even churches, where there are likely to be large congregations. One of the issues that we are encouraging is more self-regulation. Again, it is coming from that place where we believe we're going to have to live with COVID. The additional 25,000 antigen tests are expected to be here next week, and again, that will complement the 10,000 that the Ministry of Health will put at the disposal of the persons that I just mentioned. So overall, we will have the state of emergency lifted, but there are still going to be regulations that persons are going to have to be mindful of. And in respect of managing the numbers, the absolute numbers of persons who can attend functions, we certainly want the public to bear that in mind. We do not want persons to be lulled into a false sense of security. The Chief Medical Officer gave a rather torrid account of her perceptions in terms of persons, especially persons who are vaccinated, have adopted their approach that they're invincible. She has advised against this. She has also advised against persons abandoning the wearing of masks, which she sees as too common an occurrence, even in St. John's. And so we have to be mindful that all of these measures, and we're certainly going to have to, in the coming days, increase public awareness or revert the public's attention to the use of these facilities, these instruments, to be able to keep us safe. So again, the position that the government has adopted, we will lift the state of emergency on Christmas Eve. We will also continue to monitor the environment for the Omicron variant, and we have the right, we have reserved the right to review these positions on a rolling 7-day arrangement. While yesterday represented the last of our scheduled cabinet meetings, the cabinet reserves the right to reconvene if there is a matter of urgent public attention that we should have to make certain other prescriptions. Again, the measures are before you. I'd like to leave it at that, only to add one final headline point that we were delighted all as cabinet members to hear from the Prime Minister that he intends to restore the cabinet position of our colleague, the Honorable Michael Brown, in the new year. And so we are looking forward to his return in the new year. But that having been said, I'd like to leave it there to give you the optimal time to ask your questions.
All right, our thanks to Minister Nicholas, really appreciate it, and our thanks to Ambassador Hurst. So, as I said, we're a little bit short on time today. We have to truncate the proceedings because we're also getting ready for the live broadcast of the sitting of the lower house of Parliament, referenced there by Minister Nicholas. All right, let's go over to my colleagues on Skype. I'll ask my colleagues to limit their questions to 3, starting with Zoe Carlton. Good morning, Zoe. Your questions, please.
Good morning, gentlemen. First question is about COVID. Restaurants and bars, just to clarify for some of them, the protocols say that you must have a vaccination, be fully vaccinated to enter a restaurant or bar. And that is all you need to enter the bar, isn't it? There's no temperature taking, no tests. Could you just confirm that for me, please, sir?
Yes, that is the requirement, but there is going to be a further requirement that the operators need to satisfy the Central Board of Health that they do, in fact, have these measures in place. We have received numerous reports from many credible sources, even some from cabinet ministers who have attended some of these places, where operators are not requiring persons who are attending their facilities to present proof of vaccination. So this is a problem, and we intend to address it from the level of asking them to commit to putting these mechanisms in place, and breach of which would be to their own peril, because there are going to be fines associated with that. And perhaps, perhaps maybe closure as well.
Mask wearing in the bars and restaurants, is that part of the protocol, or is that overkill?
No, I mean, no one can wear masks and eat. No one can be wearing masks and be drinking. So we're asking persons to be always mindful of their surroundings. Restaurants, of course, would know that there is a certain spatial arrangement that would be required to ensure that there is significant social distance between patrons. But clearly, some of this is going to be on the basis of personal responsibility and just personal awareness of the space that's around you. But the upshot is, Zoe, and the most important thing is that we do not want operators to be scant in their disregard for the need to ensure that only vaccinated persons are entering their facilities. And we think that persons, the feedback that we've got, persons are more interested in ensuring that they're optimizing their revenue intake rather than looking at the necessity to ensure that the screening that takes place at the door, at the entry, ensures that only vaccinated persons can, with the requisite ID cards, can enter their facilities.
Thank you very much for clarifying that. Sir, while we're all very happy if we actually get our salaries on time, why has port workers been given a bonus when we're all struggling like this?
The bonus arrangement at the port, it's a historical matter related to their particular collective agreement with the union. And so it is specific to them, and it is not a general across-the-board arrangement.
Right, thank you, sir. And one last question, my third question, if I may. we talking about Mr. Michael Brown coming back into the cabinet. Does that mean there's going to be a cabinet reshuffle?
That is still a measure for the Prime Minister to make a determination, and I'm sure as he gives further consideration to it, there may be some reordering of portfolios, but I do not necessarily know that it will reach the level of being characterized as a cabinet reshuffle. But it's a matter that I think the Prime Minister has the next, excuse me, 2 weeks in consultation with other senior ministers to make that determination.
Thank you, sir. Very happy Christmas to you all.
And thank you, and same to you and your family.
So let's go over now to Nathan Owens. Nathan is with Caribbean Radio Lighthouse. Good morning, Nathan. Your questions, please.
Good morning, gentlemen.
Morning.
Minister, a question about tightening of travel protocols. I know many countries around the world are continuing to tighten their protocols in order to try and control the spread of Omicron variant into their country. Are there any plans as of yet to further tighten travel protocols for those entering Antigua over the Christmas and New Year's holidays?
Yes, we did do that ahead of time, and I'd forgotten to say good morning to Nathan. Yes, we did do that ahead of time. You would recall that some 2 weeks ago, we did announce that as of the 15th of December, which would have been yesterday, the only persons who can travel to Antigua are those who are fully vaccinated and that would sport a PCR test. We had originally looked at relaxing the entry requirements to allow for persons to use a range of antigen tests. And we would have published those, but shortly after doing that, we were faced and confronted with the emergence of the Omicron variant. So accordingly, we had to revert back to fully vaccinated and PCR, and I don't think it gets any tighter than that in terms of a restriction.
Right. Still along the lines of COVID, the cabinet notes state that private parties are still limited to 25 persons. Other than those held in biosecure spaces, can you remind us what a biosecure space is and how someone can get their location approved as such before Christmas?
I suppose that the term biosecure really was referring to approved events such like the operators would have arranged. In those arrangements, they would have had to go through a certain level of protocol test by the Central Board of Health. But more importantly, they were required to, or they are being asked to ensure that persons who are attending these events are tested the day prior, to be given an antigen test the day prior to the attendance. So to that extent, we would permit up to 300 persons to attend events like those. But in all other circumstances, we're limiting it to 25.
And my final question, the 10,000 rapid test kits that are going to be available to restaurants, clubs, bars, and churches. I know you mentioned that an additional 25,000 are on their way, but it seems that this quantity is going to get used up rather quickly. Are there any other stipulations within those groups of how they'll be distributed, who will be given preference, and who do you contact about collecting those tests?
The Ministry of Health is going to be responsible for the distribution, and I imagine in a few short moments, perhaps in the next day, tomorrow, they will begin the rollout and begin the public engagement to say how persons can avail themselves of these items. What we are now looking at, and this whole concept of self-regulation, it is likely that the government will invest more in these tests. We have identified a source that have made them pretty cost-effective for us, or at an affordable rate. And so we figure that it's prudent to invest in prevention. And these are preventive measures that we can use to ensure that the population remains active in its awareness and consideration of how to keep and maintain safety amongst themselves and their families. I have had feedback and experiences from family members, some who have contracted the common cold at this time of the year, and it has created an alarm in the family. So it would be useful if persons would demonstrate symptoms of COVID and they are tested early, then they can certainly prevent the spread amongst their own families and their neighbors and other people who they get in contact with. So the idea of making the tests readily available to facilitate that early detection can certainly lead in those circumstances to a reduction in the spread.
Thank you very much for that information, Minister, and have a safe and Merry Christmas.
Thank you, and same to you and family.
All right, thanks, Nathan. Let's go over now to Kadeem Joseph. Kadeem Joseph is with Observer Media Group. Good morning, Kadeem. Go ahead with your questions, please.
Good morning, everyone. Thanks for having me.
Good morning, Kadeem.
Firstly, Mr. Minister, just a question for you in terms of the dissemination of vaccination cards. There are some individuals who are still having issues contacting the individuals who are, I guess, distributing the cards. Have you been made aware of this, and could you address if it's an issue of how people are trying to get these cards? Are they doing things ineffectively in trying to gain the cards, or is it a matter of how the cards are being distributed from the ministry itself?
Yes, I'm aware of the complaints, and I fielded several complaints, and I'm in touch with the team and the manager on a regular daily basis. We have so far produced upwards of approximately 26,000 cards that are in the hands of persons who require them. The process is tedious, and perhaps maybe what we have not done a good job at is managing the expectation of persons. Each card on a perfect day would perhaps require 7, 8, 10 minutes to be produced. But that is not it. That is not all that goes into the production of card. Before the cards are produced, the operators are required to ensure that there are no fraudulent activities associated with the presentation of the original written vaccination certificates. And they, of course, have to do a match as well with what is in the system. And if there are any discrepancies, they had to escalate within the Ministry of Health to ensure that all of these measures are taking place. So on a perfect day, if a perfect person comes out with a card and there are no issues, it goes through the system within 7 to 10 minutes. But where there are requirements for them to do reconciliation and cross-checking to ensure that there is no fraud, then it does take a while longer. And perhaps maybe we have not managed that expectation. The report that I saw this morning has indicated that there are some 2,122 email applications that are pending, and these would have come in within the last few days. We have the capacity to produce upwards of 1,000 cards per day. But again, that is going on the basis that there are no issues in relation to reconciliation that have to be done. Again, there are some persons who submit multiple applications in the same email, and that takes a while to ferret through as well. And so oftentimes when a person do not get a response back in time, they would indicate, I haven't received my card, and they will use their names rather than the email from which the cards were sent. And so we are trying to encourage persons to be able to do that. There is a new email that we have presented. It's tracevaxcard@ab.gov.ag. And once they have submitted the original email from which the application was made, it makes it easier to search and identify where the cards have been. What I did report a few weeks ago, where there was a backlog of perhaps maybe 4,000 cards that were sitting there waiting the right persons to be able to show up to get them, we have certainly reduced that backlog down to perhaps maybe a day's work. So tremendous changes have taken place, and I would say within the last 2 weeks, more than 10,000 cards have already been produced. So I want to encourage the public to try and understand the system. It doesn't help anyone for everybody to rush down to the facilities, because having crowded environments is not helpful to even the public health. But more importantly, we would want to ensure that the processes that we put in place have an opportunity to produce the results. But we have to take the necessary precautions to ensure that there's no fraud in the system. And I would dare say that as a result of the scrutiny that is involved in the system, we were able to assist the Ministry of Health in identifying some of the fraudulent representations that have been made about some of these cards in the past. But it's an area that I will continue to keep my eyes on to ensure that we can continually improve. And every feedback that I've gotten from the public has been acted upon.
Thanks, Mr. Minister. Additionally, some clarification on Note 3, which suggests that the Commissioner of Police indicated that public events, it would be better to check those who are entering than to attempt to check after hundreds have assembled. What would surveillance look like for this holiday season with all of these events happening, as the cabinet notes have underscored, and agencies like the Pan American Health Organization stressing the importance of surveillance and proper monitoring during this time to avoid any major fallout in the new year? What has the police force committed to, and can we see additional resources or additional efforts being made by the CBH to ensure that individuals, restaurants, you name it, are abiding by the COVID-19 regulations?
Right. So, and that's a good question. I think what came out of the engagement with the chief of police yesterday had to do with the fact that, especially at this time, where the police would need to have an enhanced presence in St. John's and other areas because of what normally attends to the holiday season. He's indicated that applying additional resources may be of use to them, and I think the cabinet looked favorably at that. And so what we're likely to make available to the police force are persons who they can then deputize to do some of the inspection, perhaps as special constables, to be able to do that type of exercise, that surveillance exercise. But the subtle difference in what the Commissioner of Police was pointing to, if perhaps they were to go to, and I'm not necessarily singling them out for any adverse treatment, but it's to illustrate the point such the public can understand. There is a bar that's called the Barefoot Bar in the pensioners area on the approach to Five Islands, where on the weekends massive crowds of persons would attend. It is a significantly large facility, and in the earlier months of the regulations and reopening up the bars, there is a restaurant in that facility that can accommodate, seating-wise, up to 300 persons. And they have the flexibility of removing those seats and converting it into all manner of, it's a flexible environment that they could convert it into a club in very short order. And oftentimes the bar is being used. If that facility under the regulations become overcrowded and the police made an inspection, what the Commissioner of Police is saying is that rather than try to go to the patrons and inspect to see whether or not they actually are equipped with the cards, his contention is it would be best if at the point of persons entering the facility, the inspection would take place at that point, such that whatever counts would have to be approved and whatever entry requirements would be necessary would be satisfied at the point of entry. So I think that's the point that the Commissioner of Police was making, rather than inspect it after the fact that persons have arrived, is to do the inspection at the entry point, which is consistent with the thinking of the Cabinet as well, and would be reflected in the amended regulations that would be presented in a few short days.
Understood. I guess I asked that question in the spirit of trying to ascertain how will we identify areas or people who are flouting the regulations, if not through surveillance, and ensuring that there are enough people in the streets monitoring events, monitoring restaurants, etc., to ensure that they're abiding by the rules?
Well, again, let me say, and let me issue a word of caution. If a business establishment flouts the regulations and pays scant regard to the requirements to ensure that upon entry, persons need to satisfy these safety requirements, and they flout that, and they are caught, the penalties are going to be severe, not only from a financial, from the fines that would apply, but also they are likely to be faced with a period of temporary closure. And that could really hurt their business. So it really would be penny wise and pound foolish to attempt to flout the regulations to attract more business or to attract more revenue, and then at the end of the day be faced with the risk of closure. The idea that there could be a restaurant, and we know of several, we have the evidence, restaurants who could not put these requirements in place to ensure that persons are meeting the requirements for entry. It's really a provocation that we cannot, allow to go untreated. So we would expect the police and the Central Board of Health officers to be so equipped, and we have made more personnel as well available to the Central Board of Health, such that they can put in place between now and the 24th further mechanisms to ensure that restaurants, bars, clubs are going to be adhering to these strictures. Of course, the upshot for them is going to be how do they reconfigure themselves to deal with the reality that at the very top end, they can only accommodate 150 patrons at any one time.
Understood and agreed. And finally, with on the weekend, the Prime Minister would have suggested that the government is considering giving test kits to private homes so that during the season, they too can be a part of the surveillance efforts in stemming the spread of the COVID-19 virus. Is that still an option? And are places like restaurants, churches, and other establishments who will be receiving test kits based on the cabinet notes, are they, the administrators of these places, responsible for also reporting positive tests to the health officials?
Again, the public health position requires that if a person becomes diagnosed with COVID from an antigen test, that the next step would be for them to get that diagnosis confirmed with a PCR test. And so they would be required to attend to the Celeste Bird Medical Center for, of course, with safe passage, of course, with protection of others who may need to be accompanying you to ensure that the test can be confirmed as a PCR test. So yes, there is an obligation for persons to do that.
Thank you so much, Minister.
You're welcome, Kadeem.
Kadeem, really appreciate it. Thanks to my colleagues for keeping their questions concise. Really appreciate it. Just a few quick questions from me, Minister, to wrap things up. As I said, we are standing by for the live broadcast of the Lower House of Parliament sitting this morning. Minister, in the UK, there is the talk of a Plan B, so-called Plan B measures, for example, which might include tougher measures. They had a record yesterday in the UK, 78,000 cases in 24 hours. Is the government considering a similar kind of arrangement where if the Omicron variant were to be identified in this country, that there would be enhanced measures that would be taken? And this would be, let's say, for example, it happens after the state of emergency is lifted. Does the government kind of have a contingency arrangement in place if Omicron, which spreads extremely fast, if that is identified in the country, what happens then?
Yes. For the one thing, we have indicated that we have our 7-day review. So in as much as there is no scheduled cabinet meeting, we still have communication facilities amongst the cabinet members to be able to reach one another and to communicate without a formal cabinet meeting. And do not forget that last year, at the start of the pandemic, we were able to have virtual cabinet meetings. So there is no scheduled cabinet meeting, but if the epidemiological position would change and Omicron was to be in the midst and it started to have a rapid spread, we would certainly convene and we would certainly look at whatever further measures that we will have to do. And we, as we want to do, we will come back and engage the public, even in an emergency session, to notify. It could be at the dead of Christmas. It would not matter because the public health issue in relation to this pandemic overrides everything. So our plan B would be to continually monitor where we are. And as I've indicated, what the Prime Minister and the Parliament would consider this morning is lifting the state of emergency and with the condition that if it is necessary to return to it. And again, I just don't want any persons to believe that there is any insincerity about our effort about lifting the state of emergency. We think that the removal of the state of emergency and the elimination of the curfew is the path, the right path that we have to go to be able to make the adjustments of living with COVID. But if the emergence of the variant puts us in a position where the public health is at risk and of course the economic fallout from it is of some concern as well. We will have to take all of the measures, including a possible return to curfew conditions, to be able to bring things back to balance. But if we should be able to ride this out, and beyond the 7th of January next year, the conditions that still prevail, that we're able to keep the numbers down to a particular level, and there is no rapid spread, then you could well see that the conditions in relation to no curfew will continue into the new year.
Okay. My second question, Minister, in relation to how the post-SOE situation will look like, it will mean as of the 23rd, midnight on the 23rd, that there is no longer a curfew in effect. It means, therefore, that there will be a longer period of the day, 24 hours of the day, for surveillance to take place by the authorities. Is the CBH in a position to have, to use a term, a phrase that was used by Ambassador Hurst, does it have the phalanx of investigators and inspectors to continue to monitor the right throughout? Because there's a concern that there's been a lax surveillance generally by the police, CBH, all the authorities, that there is not been as strict as it ought to be. And so do they have that in place? And two, if there have been some breaches by some, for example, bars and so on, why have we not heard about punitive action taken, sanctions applied to these agencies or to these entities?
Again, much of the report that we have gotten are after the fact. So in order for the sanctions to have effect, they would have to be found in breach at the exact point that they would have been breaching the conditions. So what can we expect after midnight from Christmas Eve going forward? Clearly, the removal of this state of emergency will mean that there will be more nighttime activities, if you would. And the whole question of how the security forces and the health officials monitor these events will be a challenge, of course, but we're going to have to learn about these events in the hour. And that is the risk of doing that. But the idea of us remaining crib cabin and confined by COVID for any further extended period, we have gone through this for nearly 2 years already. And for us to be able to continue to live like this, it's not a sustainable position for us. And we think that it is an instrument that we have utilized to good effect. But we have learned much, and I think the public has learned much. And what we appeal in is for the good sense of persons to realize that each of us has a responsibility in being conscious and aware of what we need to do to keep us, to keep ourselves and our families and our neighbors and our friends and our co-workers safe. One of the measures that I know that the health officials are taking into consideration, we have not discussed the whole question of the bracelets for a while, but we have had some issues with the initial set of bracelets that we're using. We have gotten a different model, and from all appearances, these are a lot more sensitive, and they do work. And so my advice from the chief medical officer is that they would want to utilize these bracelets for persons who have been clinically diagnosed and are in quarantine, to put them on persons who are in quarantine, and to ensure that they remain in quarantine and are not, if they feel well enough, to be coursing through the rest of the society and perhaps maybe leading some further inadvertent spread. So this is another way that we're going to be able to manage the outcomes that we want. But there is going to be a challenge to the police and to the Central Board of Health officials, even though they are going to be given additional human resources to circumscribe that problem. But it will be a challenge. And the challenge can be reduced if the public maintains a level of consciousness and participates in the whole idea of keeping each other safe.
Okay. There's a quick part B to that question, Minister. In relation to the testing for the feds, last week, Cabinet was asked to consider by the Fed promoters a proposal where the government would absorb the cost of testing. and they would also consider that testing would be done in terms of the timing. They had proposals on the timing when the test was done. Can you say what the final position is, Minister, on the cost, whether or not the government would absorb it or the Fed promoters? And two, is the test for all 300 patrons, and is that test done before, the day before, or on the day of the Fed?
The promoters came back and said that the day before the Fed is most feasible. So, and that was the original position of the cabinet. So we're at item on that point. The other issue is the cost. The cost of the tests would be provided free of cost to the promoters for their patrons. And that's as far as the government's contribution. The medical personnel that they will have to retain to apply these tests would be to the promoters. And the government has made no indication that it is prepared to carry that cost.
Okay. Final question, Minister, is on LIAT. The government has indicated, the cabinet notes have indicated that the cabinet held a discussion on LIAT and will not engage in any further discussions with the unions. The unions are yet to accept the 50% severance that the government is offering. Is this offer on the table indefinitely, or is there a finite period within which the unions will have to accept it, or it will be withdrawn?
Let me be clear. I do not want it to come over that the government would never have a discussion with any of its social partners, including the unions. We can have a discussion to come to further clarification, but those discussions will not and must not be construed as negotiation. We are not in any negotiation. The government's legal position is that LIAT, as we know it, is bankrupt. The shares value $0. And so to the extent that the government was a shareholder and had a risk, not a risk, but an obligation, the fact that the company is worth nothing, that the government's liability has come to nothing. The government has no liabilities. Because these are persons who we know we live with, they're part of, they have families. On a compassionate basis, the government has found a way to be able to assist them in making the transition into, an adjustment. Either they open their own businesses or they find new means of employment. They have gone through much hardship. And so the government has come forward and put some resources at the availability in terms of cash, scholarships, and even land in some circumstances, equivalent to 50% of what the severance would have been had LIAT made a determination to sever them normally. The government has said we are prepared to honor 50% of it. It is not a negotiation. And until the unions accept that that is a legally tight position, that the government has no legal obligation to go beyond that, or to even do it in the first instance, we cannot engage them on the basis of having a negotiation. But of course, if the union wants to have a conversation with the government to be able to understand the modalities and how we are prepared to implement this particular measure, certainly we are prepared to engage them, but not on the basis of them coming with the expectation that they can negotiate, because it is not a negotiation, and it will not be a negotiation.
Okay. All right, Minister, thank you so much. Back over to yourself and Ambassador Hurst to wrap things up this morning.
Thank you very much, Mr. Burford. Two matters that are clear in the notes but have not been addressed. The first has to do with the provision of $2 million and that's the plant of fries, the reverse osmosis plant of fries that
Together, we can stop the spread of the COVID-19 virus.
The Medical Association of Antigua and Barbuda is committed to our patients and communities during this pandemic.
Now is not the time to let our guard down.
So on behalf of all of us working on the front line, please take this virus seriously.
It is our responsibility as doctors to encourage you to do your part.
Please, when washing your hands, remember to do so for 20 seconds.
And take advantage of the hand washing stations provided. They are there for your safety.
You can also use hand sanitizers with 70 to 90% alcohol.
Wear a face mask, covering your nose and mouth while in public.
Stay away from crowded spaces and stay 6 feet apart. Get vaccinated. We did.
Oye, mi gente, lava los manos, quédense en la casa y coge la vacuna.
We can do this together.
Apologies for the unscheduled break. Let's go back over to Ambassador Hurst. It's a little audio challenge that we've now sorted. Back over to Ambassador Hurst.
Yes, I apologize for that. At any rate, I was suggesting that there might be 2 issues that we would love to bring the audience's attention to. And one of them has to do with the reverse osmosis plant that is now ready for commissioning at Fries. And that will add about 1 million gallons of water daily to our supply, which is important. So we are hopeful that the APO will also get working on those lines that have developed leaks because a significant amount of the water produced is lost through that method. And the second has to do with the number of parcels of land or lands that have been distributed or are being distributed. Over 300 in one area and another 150 in Setons. So what we're seeing is an explosion in the number of homes that are also being built. This is remarkable, especially during these COVID times. But it has been the Gaston Brown administration's determination to keep construction alive during this period, precisely because we know that when the COVID passes, that the demand for housing is going to increase. And so we're readying ourselves for this demand. These 2 items were included in the notes, but paid little attention because of the overwhelming importance of COVID. I thank Minister Nicholas for presenting this morning, and as you know, Minister always has the last word. Minister Nicholas.
Yes, indeed, and thank you for drawing that most important item back to the center stage, and that has to do with the ongoing development with respect to the rehabilitation of the water systems to include production of reverse osmosis water, and of course the pipeline issue. Following on from that as well, the Minister of Public Utilities did advise yesterday that the next installation of the facility at Fort James, that they would be expecting the arrival of the equipment of the plant perhaps by mid-June for ultimate commissioning. We have indicated that at all times that the government did intend, since we came into office, recognizing the frequency of droughts, obviously under the whole climate change arrangement, that ultimately we will have to develop the resilience to be able to have the ability to satisfy our portable water requirements from reverse osmosis sources rather than from the traditional groundwater and surface water facilities. When we have those, of course, they are a complement and a benefit because it's cheaper to produce water, potable water from those measures. And so with the addition of the 1 million gallon per day plant at Fries Beach and the plant that it is at Bethesda that will be put in place, and the other 500,000 gallon one at Fort James, complementing, of course, those that are already in place at Barnacle Point and in Crabs, we believe within the next 12 to 18 months that insofar as the production of water is concerned, we would have achieved the optimal position. But of course, we still have to train our minds to the whole question of the distribution system, which is another significant cost. But we are certainly mindful of it. And we want to assure all of our publics who continue to have challenges with frequent pipe-borne water that it is a measure that is receiving the full attention of the government. But we just have to follow the process until we get to the change that we're looking for. We're at the end of these proceedings, and I have nothing further to say other than to wish each and every one heartiest and merry Christmas celebrations, and of course looking forward to a bright and prosperous 2022 as well. Hopefully we won't have to return to a press briefing before the end of the year, because that will only mean a worsening public health position. So it's unlikely that we will meet you again before the end of the year. And we're looking forward to meeting and serving your needs in the new year as well. Thank you very much.